Hello everyone. Today I would like to reflect on my internship experience this term. What I learned from my position as a renal dietitian, how the experience connect with my studies, and then how I plan to apply what I learned in the future. So, beginning of the intern, I mainly thought of my role as a renal dietitian from a clinical perspective. I do focus more on assessing the patient nutrition status, view their labs, providing nutrition educations, and then helping dialysis patients manage their nutrients such as phosphorus, potassium, sodium, fluids. However, throughout the internship, I realized that being a renal dietitian involved much more than that. So one of the biggest thing I learned was the importance of the data, the quality improvements, and the health informatics in the clinical nutrition. During my internship, I regularly review lab reports for a large potential populations, which means it's 180 patients, identify their abnormal values, documented the possible reasons for those abnormalities, and then provided individualized interventions and then educations. I also participate in the quality assurance meetings monthly, and then including the reporting, analyzing the data, and then finally um, presenting in the meeting. For example, I help collect and organize monthly lab data and develop the Excel spreadsheets using formulas to automatically calculate the percentage of the patients who were below meeting or exceeding the specific goals. I learned that even something as simple as calculating the percentage can become very complicated when working with a big data set from more than 100 patients. I also learned that the importance of checking the accuracy of data before using it for the QA decisions. Another important experience was participating in the meeting. I presented the facility level lab performance data and learned how quality measures can influence the overall performance rating of our center. One interesting discussion involved a quality goal that our facility has not met. After discussing it with the administrator and other interdisciplinary team, we realized that the target has become extremely difficult to achieve because the benchmark had continued to increase over time. This taught me that data should not simply be reported, they need to be interpreted in the context of the clinical practice, the patient's behavior, the staffing, and then also organizational processing. So all of those experience connects directly with my studies in the health informatics because many of the concepts I learned academically became the real world problems during my internship. In the class, we discussed topics such as the data quality, the EMR systems, privacies, automations, the quality improvements, and the use of the technology, Excel, the R, SQL to support healthcare decisions. And during my internship, I was able to use how those concepts actually affect the clinical workflow. For examples, I do learn that an automated Excel system can save a lot of times, but it also needs validations to prevent the errors. I also learned how privacy and HIPAA requirements influence how patient information is handled and communicated. Most importantly, I learned that health informatics is not simply about technology, it is about using the information and technology to improve the healthcare process and patient outcomes. The internship changed how I think about my future career. I used to see myself primarily as a clinician. Now I see an opportunity to combine my clinical experience and background with the health informatics and data analysis. So in the future, I would like to become more confident and comfortable with advanced Excel function, the data visualizations, maybe help with electrolyze medical record systems, and then potentially using the AI tools and collaborated into our health record system. I also see myself using the skills to develop better clinical dashboard to support clinical decisions and identify patients who need follow-up, support the individualized nutrition care. Overall, the internship taught me that a successful healthcare professional needs both clinical knowledge and the ability to work with data and technologies, especially in the nowadays. I learned how patient care informatics, quality improvements, the AI enhanced tools, and also interdisciplinary communication and collaboration are all connected. Most importantly, I know that the technology should not replace the human side of healthcare. Instead, it should reduce the unnecessarily administrative work and then give healthcare professionals more time to focus on one-on-one patient communication, face-to-face patient time. Moving forward, I hope to continue develop both my clinical and technical skills so I can use health informatics to make renal nutrition care more efficient, more accurate, and more patient centered. Thanks for listening.